Increasing penile length and girth in healthy men using a novel protocol, the P-Long study, by Dr. Judson Brandeis, Dr. Scott Liu, Dr. Rena Malik, and Dr. Charles Runnels. Introduction. Various therapies have been utilized to increase penile length and girth, with some exhibiting significant adverse event profiles, including fillers, fat transfers, suspensory ligament ligation, and silicone augmentation. Our team sought to evaluate a novel combination therapy to enhance penile characteristics using PRP or platelet-rich plasma as a source of autologous growth factors, penile traction for lengthening, vacuum erection device for girth enhancement, and nitric oxide precursor supplements to augment penile vascular smooth muscle function. Objective: to evaluate the safety and efficacy of combination therapy with PRP, traction, vacuum device, and nitric oxide boosting nutritional supplements to increase penile length, girth, and function in healthy men. Methods: a prospective non-randomized study was designed to evaluate the efficacy of combination therapy in healthy men aged 20 to 55 with baseline normal erectile function and no penile pathology. Penile length and girth measurements were obtained using at-home photography of an erect penis with maximal tumescence. Measurements were obtained at baseline and at monthly intervals times 6 months. PRP, a modified P-shot procedure, was administered in the right and left corpora under ultrasound guidance once a month for 6 months using pure spin, double spin system, 60 cc blood drawn. Centrifuge technical data show an average platelet recovery of 84% and average concentration of 6.6 times that of the whole blood sample. Using this data, the injection of 10 cc's of PRP, assuming a starting platelet count of 250,000 per microliter, would contain approximately 1.65 billion platelets. Subjective erectile function was assessed on a 5-point Likert scale. RestoreX traction device was utilized for 20 minutes, twice daily, and a Dr. Joel Kaplan vacuum erection device was applied with a 5 to 10 millimeters of mercury pressure times 12 minutes. 1 minute times 2, 5 minutes times 2. Oral nitric oxide boosting supplementation was with Affirm, which consists of 3 grams of L-citrulline on 1 gram of beet extract. Results: a total of 32 men have been enrolled, with 16 having complete data available for review. The 6-month mean increase in size of the erect penis was 0.85 inches in length, with a linear increase in size. The 6-month mean increase in circumference was 0.47 inches. Mean age was 32, and mean baseline erect penile length was 5.70 and girth was 5.25. All 16 participants reported better penile rigidity with erections. No adverse events were reported. Conclusions: results from a pilot study using a novel combination therapy called the P-Long protocol in healthy men demonstrated increases in penile length, girth, and subjective rigidity improvement compared to baseline with no adverse effects. External validation is warranted. The P-Long protocol does not require any synthetic injectables or foreign bodies. It does not preclude additional augmentation procedures. The slope of the growth curve indicates possible continued growth with additional treatments. Thank you.